Congressman Brendan Boyle, a Democrat representing Pennsylvania's 2nd District. Congressman, thank you for taking the time and being here. As a ranking member of the House Budget Committee, I'd just like to get your reaction to the cuts we've seen so far and the cuts we're expecting to see in the coming weeks, if you think it will affect services. Performative nature of the golden, chainsaw aside, these cuts are happening.
There is no question that this will severely impact the kind of services that my constituents are used to. Let's just take the IRS firings, for example. A few years ago, my number one constituent service issue, and if you talk to a lot of members in Congress who were in office at that time, 2021, 2022, by far the number one constituent service issue, the one that the most of my constituents, the one that was the most problematic, was IRS wait times, where IRS took forever in order to get back to people. You would have to call. The average wait time on the number was about 67 minutes. You would have paper filings that actually took years to finally be recorded into the IRS system. If someone was amending their return, it would take the IRS several years, because their staff complement was about 40% lower of what it was in 2010. Then, under the Democratic majority, we passed legislation in order to increase hiring at the IRS. This was mostly for folks to do constituent service. And then suddenly we saw IRS wait times plummet. It's no longer the number one complaint that we have in our office. So I'm very nervous that these firings are happening at the absolute worst time, and we will have millions of Americans here in my district, but throughout the country, suddenly having all sorts of headaches and issues with the IRS. They'll call the customer service number, but there'll be no one on the other line to pick up for them.
Since the president took office, Republicans in Washington have discussed making changes to Medicaid, particularly by requiring enrollees to prove they're working. Because most enrollees already work, go to school, or serve as a caregiver, or even have a disability. Doesn't this requirement simply add red tape to obtaining coverage with little impact on employment?
That's exactly right. Arkansas actually proved this point. They originally had this requirement. What you found is that people who were essentially the working poor were unfairly kicked off Medicaid. The reality is, in the bill that passed last week out of the House Budget Committee, on which I'm ranking member, it has included in it, at least as a minimum, $880 billion worth of cuts to Medicaid. They would be by far the biggest cuts in American history to Medicaid. There's 72 million Americans who get their health insurance through Medicaid. So we're talking about tens of millions of Americans who will be impacted, not just by the additional requirement, but by cuts in so many other ways beyond just the one requirement that you asked about.
And Congressman, it's so great to have a ranking member of the House Budget Committee to have this conversation with. I have this question, and I think a lot of Americans are asking it. We're hearing that the president and Elon Musk are saving billions and billions and billions of dollars. We hear it every time one of them is in front of a camera. My question to you is this: they're now talking about dividend checks. How does something like that even work?
It doesn't. It's total BS. There will be no dividend checks, period. Look, to give people an idea of what government spends money on, if you just took 4 areas: Social Security, Medicare, Medicaid, defense, and veterans health care. If you cut everything else government did, a 100% cut to everything except for, again, Social Security, Medicare, Medicaid, defense, and veterans, guess what? There would still be a budget deficit. The reality is, even if you cut 100% of everything else, because so much of what government spends money on is in those 4 areas that I just identified. So unless you're going to really cut very deeply to Social Security, to Medicare, Medicaid, or defense, you're not actually going to see really big and meaningful cuts. That is actually why the Republicans are going after Medicaid to the tune of $880 billion, because that's the only way the math comes even close to starting to add up. But even at that, of course, they would be adding $4 trillion more to the national debt because ultimately their math doesn't entirely add up.
All right, so you won't be looking for a dividend check in your mail anytime soon.
I will not hold my breath.
All right, Congressman Brendan Boyle, thanks so much for the conversation. Do appreciate it.